All right, everybody, we're back with a brand new Cabral Concept, episode 3471 of the show. If you want to check out all of the research from today's show, pretty impressive, especially if you know anybody with high blood pressure who's looking to improve their overall heart health, vascular health, veins, and so much more. This is absolutely in my Mount Rushmore of recommendations. I've talked about it before, but it just seems to keep showing up as something that, you know, it's pretty simple. It's pretty straightforward. It's a lot like walking. I'll actually be talking about that on tomorrow's show. But if you're not doing it, you're really missing out. And the truth is this, is that we sometimes want to look for the most flashy thing in the world to do, but it's often the basics and the foundations that if you're not doing those, the other things don't really matter. You know, buying a $75,000, $100,000 red light bed, it's amazing. And if you can afford it and you want to get that, that's great. But it still does not compare to something like sauna. Not even close. It's not even in the same realm or conversation. Red light is great. I use red light. I don't have a $100,000 red light bed, but I use red light. And I'm a huge proponent of it for hair growth and hair thinning. For the mitochondria much more, but really it doesn't touch sauna. And I won't go over all the reasons of how sauna works today, but I will link it up. So if you don't actually know how sauna works and really why it's a top 5 health recommendation, I'm going to link up additional shows at stephencabral.com/3471. And I'll just start with the show, the link up, and then I'll add others as well, of 19 minutes of this reduces all-cause mortality. It's one of the best studies. It's absolutely phenomenal. And it helps with the #1 cause of mortality, which is heart-based disease. So let's look at this now. This is the latest study that we're really looking into with great research behind it. And it's called Adding Sauna to Exercise Further Lowers Blood Pressure and Cholesterol. Now, let's keep in mind that high blood pressure, or I should say cardiovascular disease, heart attacks, and strokes, which can also happen as a repercussion of high blood pressure as well, are really the top 2 causes of death, and especially among men. It's men and women, but you know, men are just more likely to die earlier because of heart-based issues, high blood pressure, etc. So this is a big one for me, and that's because exercise, which is phenomenal. Again, you know I'm a huge proponent of exercise. It's how I started my career, but adding short, not long, post-workout sauna sessions, which takes really no effort from you, amplifies your overall cardiovascular gains, including drops in systolic blood pressure and total cholesterol. Let me break down the study for you right now. And obviously why this matters is that if you don't die from heart disease or high blood pressure or type 2 diabetes complications, you're far less likely to get cancer and far less likely to get Alzheimer's. If you don't get one of those top 5, your chances of living an extra 10 healthy years goes up exponentially. So you're no longer looking at a mortality rate in the mid to upper 70s. You're looking at now close to 90 years old. And they're not just 10 more years, they're 10 more healthy years. If you're not dealing with all the statin-based drugs, beta blockers, diuretics, etc., that, you know, absolutely annihilate your kidneys. And yeah, they'll keep you alive longer, but you'll unfortunately have to suffer the repercussions like I've seen too many people have to do because of the medication. So let's go over this now. Amazing study. So this was exercise only. So basically they broke people up into 3 groups. Exercise only, and it was 3 times a week. Guided based exercise, your typical pushes and pulls, nothing wild, nothing crazy for exercise at all. By the way, this was done on sedentary adults, so don't think that you have to be in great shape to do this. Sedentary adults, 30 to 64 years old. So one group was exercise only. The other group was exercise plus 15-minute sauna session after each session. So 3 weight workouts, plus the 15 minutes of sauna afterwards. And then there was the control group, which was basically nothing. They just continued to live their life. This study went on for 8 weeks, and only 8 weeks, which is wild because they got results in just 2 months, 2 months time. I mean, I find that to be incredible. So compared with exercise alone, the exercise plus sauna group saw greater improvements in cardiovascular fitness. Basically, there is it's 8 millimeters of mercury. That's basically just kind of how you look at the reading of a reduction in systolic blood pressure. All right, so let's break that down. What does that mean? So when you take your blood pressure, you're going to do it typically on your left arm. You're going to do it about an inch or two above the breast, the fold in your elbow. You're going to make sure that the cord is running straight down your arm. You're going to keep your arm at about height or just a little lower on a table. You're going to sit still and you'll take 3 readings. And then you basically want to take the average of those 3. But sometimes the first one's high because you're worried, you're breathing, you're looking at the machine. Don't do that. Just relax and take the reading. And so the top number, usually let's just say normal is considered 120/80, although healthy is really like 110/, call it 70, 75 or so. The top number is the systolic, okay? So if that number goes down between 5 points and 10 points, it is a massive reduction on stress on the heart, and the cardiovascular outcomes are enormous. It's honestly, it's huge. If you go from 140 to 135, big drop in blood pressure for people. Like you're basically back in the, safer zone. If you go from 135 to 130, again, another big drop. So these are big numbers and lowering of cholesterol. Both active groups saw fitness improvement versus the control, but the sauna group delivered an added cardiometabolic edge. I'm going to link that up here today at stephencabral.com/3471. Again, really impressive. This was a 2025 based study, so this is very recent. And what I want to see is this study done across 12 more months. Because what are you really asking the individual? So keep in mind, we're looking at 30 minutes of exercise or so, plus a 15-minute sauna. I would say that's fair. 30 minutes of exercise plus a 15-minute sauna. If it was my clients, I want to share with you exactly what I would do in my practice and what I share with my clients. So my clients do 2 to 3 weight training workouts per week, and I like them to also do that number in cardio workouts per week. They can do it directly after their weight training, or in an ideal world, it's just going to be every other day. It lets their muscular and nervous system recharge, and the off day is really just aerobic-based training, although 1 day a week, if they want to, only when they get more fit, will we start to incorporate more of max VO2 based training. I had that on other shows. I'm happy to talk about that, but I don't want today to be just like the exercise show. Okay, so let's just say you did a Monday, Wednesday, Friday, and you did 30-minute weight training session, and then your sauna can actually act as part of your cardio-based session. That's the amazing part to it. So you would just add it directly on. So all you would say is, okay, on Monday, Wednesday, and Fridays, I'm going to dedicate 60 minutes to my health. 3 days a week, right? Or you might say, well, I can't do it 3 days a week. Okay, pick Tuesday, Thursday, Saturday. Pick one weekend day and 2 of your weekdays if you want. Okay, Tuesday, Thursday, Saturday, 30 minutes, plus you're going to do a 20-minute sauna. You just have a 10-minute buffer in there. That's really it. Inside of the sauna, if you feel like you're just wasting your time, you shouldn't. You should actually be calming your nervous system, meditating, stretching, or just working on breath work, relaxing your body. You don't need to do, bring an exercise bike into the sauna. It's a bit much. Again, like that's a really Western-based mentality. We're trying to move into the parasympathetic nervous system, which relaxes the sympathetic tone, which then lowers blood pressure. So again, don't try to don't over-optimize things that don't need to be over-optimized. Get a great workout in of pushing and pulling, full body workout 3 times a week, and get in those 3 saunas. Even if you don't get the 4th and 5th sauna, which add even more value, it's okay. You got in 3. If you can get an extra one on like a Sunday on a weekend, do another 20-minute sauna, phenomenal. But you really don't need more than 20 to 30 minute sauna. I do recommend 20 minutes because it goes back to the Finnish sauna, which was a 20+ year study on almost 30,000 men, I believe. And it was right at 19 minutes or greater. So it was basically a 20-minute sauna. So that's what I recommend. Here's the great thing is that this is not going to overly tax your body. It's not going to dramatically take away from your social schedule, your family time, or whatever it might be. I mean, invite the whole family to exercise in sauna. That's the truth. And all of these things can be absolutely tremendous in terms of your health span, not just your lifespan, but keep in mind, we want to do this for the long term. So a lot of people look at their health-based routines and they say, what can I do here, over the next month or 2 months to, optimize everything? No, think about what can I do over the next decade? That's really how you want to look at this. So if you can realistically do 2 weekday workouts while you've got kids, you've got all those things. Okay, Tuesday, Thursday, and then try to make it every other day. Okay, Saturday will then be another workout, and that'll be a sauna. And if you just get that and you say, well, the studies look at 3 to 4 days a week and 4 to 5 days a week, you know what? 3 times a week, so much better than nothing, and you're getting great results just based on those 3 workouts plus 15-minute sauna. If that's all you can do, stick with it. Be proud of yourself. It's absolutely amazing. And it, again, like this very well could save your life. So pass this on to other people. Show notes are at stephencabral.com/3471, and I'm going to link up my additional sauna-based shows there. Have an amazing rest of the day. I'll be back tomorrow with a brand new Cabral Concept. Take care. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.